Hello, this is Dr. Mohammad Athaullah from Care Hospitals Malakpet. Today, I would like to tell you something about a special issue called a metabolic syndrome. Metabolic syndrome is nothing but a situation where a patient has a constellation of features. The patient will be obese, his body mass index will be more than 23 or 25, number one. Number two, the patient will be having high cholesterol levels. The type of cholesterols which we see in the practice day to day are two which are very, very dangerous. One is an LDL cholesterol, which is a dangerous type of cholesterol. And these patients have high LDL cholesterol, and also these patients also have high triglyceride levels. These are the two important cholesterol issues which we see in these patients who have metabolic syndrome. And another abnormality which we see in these patients is low HDL cholesterol. What we tell is HDL cholesterol is a beneficial cholesterol, and low HDL cholesterol is bad for health. This is about the cholesterol levels. One, I told you about the body mass index. These patients are obese. Number two is the cholesterol. Number three, these patients also have some other important issues like diabetes mellitus and hypertension, which adds to the problem of this metabolic syndrome. And these patients also have a very high waist hip ratio, which makes them more vulnerable to the coronary artery disease or vascular diseases. So this is an important aspect of today's lifestyle diseases which we see in our practice day to day, because obesity is assuming a very huge proportions these days, and obesity is the mother of all diseases. I would like to tell you that obesity is the mother of all diseases, and obesity can lead to the osteoarthritis of the knee joints. Obesity can lead to atherosclerotic cardiovascular disease like heart attack and stroke. Obesity can lead to kidney disease, where the patient may have to be put on hemodialysis, or patient has to be subjected for renal transplantation. Obesity is also an important cause for a disease which has been present since a very long time, but we are seeing this of late very commonly, the so-called obstructive sleep apnea syndrome. So a few features about obstructive sleep apnea syndrome, where the patients will have daytime sleepiness, they are obese, they may also have some thyroid disorders, or they will have a snoring at the night time. And if you check check the oxygen levels of these patients by using the pulse oximetry, the oxygen levels will be very less. So how to detect these patients with obstructive sleep apnea? You can subject these patients for a test called polysomnography or split night sleep studies. So you can pick up these patients by these tests, and the treatment for this obstructive sleep apnea is only putting the patient on automated CPAP therapy or a BiPAP therapy, which are the machines which are applied to the nose and mouth, where the patient has to keep the machine for 3 to 4 hours or 4 to 5 hours in the night time. And also he has to reduce the weight and see that he becomes a little better. So these are some of the important aspects of lifestyle diseases which we see in our practice, because increased weight or obesity is an important cause of majority of the diseases which we see in our patients. Apart from this, the patients has to adopt a healthy lifestyle of walking 30 minutes per day, which is essential for all these patients, avoiding foods which are in high calorie or simple sugars, which may lead to high blood sugar levels as well as putting on the weight, and avoiding junk food like cool drinks, or even the culture of pizza and burger has engulfed all of us these days. So avoid these foods which are sold outside in the market. So it's always better to consume home food, and also consume fruits and vegetables which have high antioxidant levels. High colored fruits and high colored vegetables have high quantity of antioxidants, and consuming 50% of the diet in the form of fruits and vegetables will give you good quality of life, as well as you can lose weight by consuming these type of foods. So my simple advice would be to, first of all, avoid weight gain, adopt a healthy lifestyle, go for a brisk walk half an hour per day, or if you are having some other facilities like swimming and other things, you can go do this, and also eat healthy food which keeps you healthy and prevents you from cardiovascular diseases, and have a good quality of life. Thank you very much for a patient hearing.